Chicago rain needles the windows. The elevated train screams past the hospital like a metal animal taking a breath. Inside the ER monitors keep time. Beep, beep, beep. Fluorescent light flattens color and sharpens edges. The floor smells like wet wool and antiseptic. You're the new trauma fellow. Dr. Adrian Klein does not look up from the chart. His voice is clean and clipped, no space for pleasantries. Yes, sir. Dr. Maya Ellis stands 3 feet away in new scrubs. Dark hair braided tight and low. Her badge swings once catches the light. At her throat, a slim cord holds a thin piece of scuffed metal the size of a thumbnail. The corner shows a faint string of stamped numbers. It disappears again inside the collar. Klein flips a page. 4 years unaccounted for. He taps the blank line with a pen. You can explain that later. For now, sutures. Start simple and stay out of the way. Copy, no edge, no plea. She keeps her hands at her sides, fingers loose, knuckles quiet. Nia Brooks RN rolls a card over and looks Maya up and down without the usual heat. Bay 3 is waiting. Supplies are staged. Her voice has warmth and gravel from too much coffee and not enough sleep. Maya reaches for gloves. 1 motion per glove, no corrections. The latex snaps tight against her wrist. Second skin, Nia notices. Most people tug. Most people smooth. This is 1 clean snap and done. Bay 3 is half curtained. The patient sits on the gurney with his right forearm swaddled in gauze that bloomed red and dried at the edges. He has calloused hands and a face that went older the day he picked up a saw for a living. Caleb Ortiz, Maya pulls the curtain closed, not completely leaving the gap Klein likes for quick checks. Yeah. He gives a tight smile. Circular saw ran hot. Stupid move. We'll fix what we can. Her voice is even. I'm Dr. Ellis. Betadine opens in the air like a penny between teeth. She peels the dressing back. The wound is clean on the surface, 8 centimeters jagged edges that will lie if asked to. Her gloved fingers test the surrounding skin. Warm, not hot. She presses gently near the cut. Blood beads, then slows. She looks at the finger's thumb and index at the nail beds that are too pale for this room's light. Can you feel this? She touches the pad of his thumb, then index finger with the tip of a cotton swab. Not like before. He blinks, kinda numb. It got worse on the ride in. Maya nods and lifts his hand to chest level. She pinches the nail bed of the index. 1, 2. Capillary refill lags. Thumb is no better. Her other hand finds the radial pulse at the wrist. Present, wrong quality. A resident's head pops through the curtain. Dr. Ravi Shah, hair flattened into surrender under a disposable cap, eyes bright from caffeine. Hey, new fellow. You drew the easy straw. He grins past the mask. We'll trade when you get bored. Maya keeps her eyes on the wound. I'm where I'm assigned. Sure. He vanishes with the rattle of a chart. The monitor in the next bay chirps, then settles. Nia hovers in the doorway. What do you need? Doppler and portable vascular imaging. Maya's gaze never leaves the hand. Also set a micro tray. 7-0. Headlamp and loops. For a laceration, Nia says it's soft, no accusation. She's already moving. Injury is not the problem, Maya says. Flow is. Klein's voice floats from the hall. Ellis vitals are stable. Do not complicate a straightforward case. If we wait, this hand goes silent. Maya says it to the room, to the rain, to anyone that knows what a motor does when starved. I want imaging. Nia's eyebrows lift a millimeter. She pushes the card in with the Doppler wand sitting like a silver fish in a sterile tray. The microset rides underneath. On the top, instruments are arranged like a compass. Clamp, forceps, scissors, needle driver. The tiny packet of 7-0 sits at 2 o'clock just so. Nia glances at Maya as if she's reading a familiar map. Maya clicks on the pen light and moves it across Caleb's fingertips. Try to move your thumb. It twitches. Weak. He swallows. Am I losing it? I'm working to prevent that. She keeps her tone grounded. Do you remember exactly when the numbness started? On site, after the wrap. How long between the cut and the wrap? 15-20 minutes. We were on the 10th floor. She listens to the rain stitching the window. She hears the L rattle over metal, the sound hitting the building's bones. The room is its own small world. The world outside pushes in at the edges. Dr. Zoe Park glides by the gap with 2 cups of coffee and a chart between her elbow and ribs. She and Ravi slow for a heartbeat enough to catch the tableau. You see her layouts? He murmurs. Zoe takes in the micro tray. That is muscle memory. From where he asks. Not from YouTube. She moves on. The coffee smell leaves a thin line behind her. Nia swabs the inside of Caleb's wrist. The cool gel kisses skin. Maya takes the Doppler and rests it against the artery. The speaker answers with a thread of sound, not the sharp whoosh she wants, but a tired whisper. She walks the probe a centimeter up. Another whisper. She looks at the wound again and imagines the vessel underneath like a split hose edge curled inward, pretending. Caleb, I am going to ask you to stay very still. We are taking images. This will guide our next step. He watches her eyes, finds nothing frantic there. Okay. The portable unit boots with a small chime. The screen throws a river of gray into the room. Maya guides the probe until the vessel comes into view. The lumen narrows, then collapses, then tries again. She measures. She traces. Nia reads her face more than the image. Klein appears at the gap as if conjured by the word no, report. Compromised radial flow, Maya says. Likely partial tear. Thumb and index with delayed refill. Loss of sensation. He needs micro repair. Klein's mouth tightens. He steps in and takes the Doppler as if the device is the problem. He listens and hears what she heard. Still he hesitates. You are 3 days in. Arteries do not care. Maya lets a breath out. It does not shake. I can do this here. Nia looks from one to the other. The room holds still. Caleb holds still too because his hand has become every hour he has ever worked, and all the hours after that. Klein's eyes go to the setup. He notices the tray, the order, the loop glasses folded in the corner like a sleeping thing waiting to be woken. You trained micro. I have done enough, Maya says. The rain thickens for a moment. Somewhere outside a siren lifts and drops. The train thrums past again. The beeping in the next bay keeps perfect time. The ER does not pause. It never does. Klein taps the chart against his palm. Once, twice. Fine. Proceed. I will be back for the final check. He refuses to give ground and also gives ground. He leaves with his jaw set. Nia leans in. You need anything else? Sterile field wider. Maya ties her mask and scrubs like she's rinsing paint she cannot see. The thin metal at her throat flashes again when she bends and settles against skin when she straightens. Numbers. Nia files them away without trying to. She peels back more drape. The room narrows to light and latex and the wound that is not the wound. Maya lowers the loops onto her face. The edges of the world blur. The artery becomes a landscape she knows like a road she has walked blind. She checks the angle for the clamp. She tests the give of tissue at the margins. She sets the needle driver in her dominant hand and feels the weight settle like a familiar tool. Ready, she says. Ready, Nia answers. Maya reaches for the procedure lamp. The switch clicks. Cold light floods the field and turns the gauze white as snow. Cold light holds steady over Caleb's arm. The room tightens to a circle of white, a smell of iodine and breath moving in and out. Maya Ellis lowers the loop's check's depth, then sets the tiny vascular clamp with a touch that feels like placing a coin on quiet water. The tissue gives a little. The field stops pulsing. Silence gathers in that narrow space where blood used to push. 7-0, she says. Nia hands the suture needle already mounted in the driver. The needle glints once. Maya lines it at an angle that will not pucker. Her wrist rotates very slightly. The point enters the arterial wall as if it asked permission and was granted. She brings the edges together without crowding them and ties with economy small square knots that know exactly how tight they should be. Outside, the curtain trolley wheels squeak. Somewhere to the left, a monitor alarms and goes quiet. Rain ticks at the window. The elevated train rushes past and leaves a vibration in the floor that only people who spend nights here notice. Ravi Shah appears at the gap with Zoe Park a step behind. They do not speak at first. They watch the hands. Ravi breathes out through his nose. Look at that spacing, he whispers. Zoe leans in just enough to see the stitch line. No drag, no hesitation. She means it as observation, not praise, but her voice carries both. Maya keeps the rhythm. Suture. Check. Suture. Check. The Doppler lies beside the drape like a patient instrument. She glances at the color of Caleb's fingers, still pallid. She lays a fingertip on the distal pad of the thumb and thinks not in words, but in distances. Pain is okay, she asks without lifting her head. Pressure, Caleb says. Not bad. Good. Keep the hand still. Minutes line up behind her. The loops make the world a clean border with a sharp middle. Nia anticipates without being asked. Clamp here, irrigation there, The headlamp paints a tight oval that holds the small red logic of the repair. When the last stitch lands, Maya waits a beat, then releases the clamp in a slow count. The artery fills, the suture line holds. A thin red ribbon becomes a tube again. Doppler, Maya says. Nia places the wand. The speaker answers with a clear whoosh that lifts the room. Not loud, certain. Maya walks the sound past the repair and back. She checks capillary refill. 1 Mississippi, 2. Color returns to nail beds like a shy blush. Caleb flexes his thumb a fraction, then his index. He exhales and closes his eyes. Feels like it woke up. It should wake more as swelling comes down. Maya's voice is steady. We will splint. We will watch for rebleed. We will give you instructions for hand elevation and follow up with vascular. Klein arrives at the gap with his shoulder squared. He does not speak right away. He reaches for the loops on the side table and lifts them to his face. He takes a long look at the line of sutures. He checks the flow himself. He sets the loops down very carefully. Document the repair, he says. Order the post-procedure orders. I will sign off when the note is in. He looks at Caleb. You got lucky. Caleb nods, still holding his breath like luck might leave if he exhales too hard. Klein leaves. He does not say good job, but he also does not change anything. That is its own kind of admission. Nia helps Maya strip the gloves. The latex peels with a soft pull. A new pair snaps into place. Second skin. The metal at Maya's throat glints when she reaches for the keyboard. Nia catches the flash of numbers and feels the nudge of curiosity, then lets it go. Curiosity does not save lives in the minute between cases. Bay 7, Nia says. Gloria Wu. Fall downstairs. Complains of wrist. Imaging pending. On it, Maya says. They move in a line that is not rushed and not slow. It is the line of people who have learned the exact speed of necessity. Bay 7 is lit softer than 3. Gloria Wu sits on the gurney, cradling her left wrist. She is small and self-contained in her red cardigan and sensible shoes. Her breath moves under the cardigan like a bird that is deciding whether to fly. I am Dr. Ellis, Maya says. Tell me where it hurts most. The wrist, Gloria says. Her voice is soft with careful consonants. I fell forward, grabbed the rail. It bent. We will take care of the wrist, Maya says. She pulls on new gloves and warms the stethoscope with her palm. She sets a hand on Gloria's ribs without weight. Breathe in for me. A little deeper if you can. Gloria inhales. She makes it halfway and stops, mouth flattening with surprise at her own limit. Maya watches the chest wall. The left side moves oddly. Not by much. Enough. She taps along the ribs in a grid. Tap, tap, tap. When she reaches the 7th and 8th spaces on the left, Gloria flinches. Any pain when you breathe, Maya asks. A pull, Gloria says, like something tight. Maya nods. Nia, we need a portable chest x-ray, left side markers, and start continuous telemetry. Keep her on the monitor. Give her oxygen by nasal cannula at 2 liters. Nia raises her chin. For a wrist. The chest first, Maya says. The wrist will wait. Klein's voice carries from the hall. Ellis, what are you doing with 7? Ortho can splint a call without you. Maya does not raise her voice. Possible flail segment at 7 and 8 on the left. With a small pneumothorax. She is compensating now. I want imaging. There is a small pause. Klein steps into the doorway. He watches Gloria breathe. If you know what to look for, you see the left side. Fall in when the rest of the chest wall rises. Subtle. Wrong. Run it, he says. Stay with her until we know. The portable film arrives with a tech who smells like rain and plastic. The plate slides behind Gloria's back. The X-ray hums and clicks. The image appears on the monitor in the hall with a series of thin lines and shadows that mean nothing to patients and everything to people who read this language. Ravi and Zoe drift close and stand wordless, then lean in at the same time. Zoe points with a capped pen. There, she says. Rib fractures, segment movement, small left pneumothorax. Ravi's eyes go to Maya through the glass. She heard it. Maya is already prepping. Betadine blooms in careful circles. She draws up lidocaine and lays a small wheel, then walks the needle along the rib to block the intercostal nerves. She makes the incision with a scalpel just long enough to do the job, then trades for curved forceps. She advances with pressure that is firm and not cruel. The forceps find the space between bone and muscle and open a path to where air should not be. Tube, she says. Nia hands it. The tube goes in with a smooth, confident push. There is a moment of resistance, and then the feeling like passing a threshold in a dark room when your hand learns where the doorway is. Maya connects the tube to the water seal. Bubbles begin to percolate. Air leaves a place it had no right to occupy. Gloria's next breath is bigger. Her eyes widen a fraction. The pulse oximeter number climbs and settles at 99. The monitor loses one of its worries. Dr. Evelyn Tran peers in long enough to check the respiratory rate and the rhythm. Placement looks beautiful, she says. She's not given to extra words. She disappears to answer a page. Klein returns again. He does not ask permission this time. He slides a gloved finger along the insertion site. Clean angle, secure stitch, dressing neat and dry. Textbook, he says, which is a way of saying he has nothing to fix. Maya makes a small note on the chart. She orders analgesia and repeat imaging in an hour. She covers Gloria's free hand with a towel taken from the warmer. Thank you, Gloria says. You are welcome, Maya says. It lands plain and true. In the resident lounge, the fluorescents hum and the coffee burns. Ravi tips sugar into a cup as if he is trying to make up for lost sleep with sweetness. Zoe unwraps a protein bar with an engineer's precision. You saw the tray, Ravi says. Needle at 2 o'clock, spacing like a ruler. Zoe nods. That is not borrowed confidence. That is the kind you get from doing a thing until your hands know it before your head does. Naya walks in and steals the least terrible mug. She pours coffee that does not deserve the name. She blows on it and sips anyway. You are both looking at the wrong thing, she says. Ravi lifts his eyebrows. Enlighten us. She does not flinch, Nia says. The room changes shape and she does not flinch. They are quiet for a moment because this is true and because it does not fit neatly into a note. Back in the ER, Maya signs the orders and moves. The rain seems to have changed its rhythm. The train outside hits a joint in the rail and makes a noise that sounds like a knife on slate. Nia hands her a fresh stack of charts. The metal tag at Maya's throat shifts and flashes its small secret again when she turns. The overhead speaker pops. A tone drops into the air that does not belong to normal busy. The charge nurse lifts a hand without looking at anyone and presses a button at the desk. All units mass casualty incoming. Elevated track collapse on Lake Street. Multiple cars down. Multiple critical, 8 minutes. The ER inhales. Voices pick up, carts move. Klein steps into the center of the room. Clear bays 1 through 6, he says. 2 ORs ready. Call in trauma call list. Move. The lights above the critical bays shift to red. Sirens begin to layer on top of the rain. The floor feels like it is about to learn a new rhythm. The ER splits like a school of fish. Carts slip into hallways, curtains fly open, beds roll. The charge nurse's voice cuts through the noise and gives it a spine. Klein takes the center of the room and turns a storm into lines. Trauma 1 to 3 are critical. 4 and 5 on standby. 6 for stable arrivals. Park take airways. Shaw belly and pelvis. Ellis basics and hold. Copy, Maya says. Sirens braid with rain. The doors open and let in wet air and diesel. Paramedics flood the bay faces, slick jackets, dark radios at their shoulders talking to no one inside this room. The first gurney blasts past a man with a leg folded where legs do not fold, skin the color of old paper. The next is a woman with a chest that rises too fast under a soaked hoodie, then 2 together, then another. Each has a story written in blood and motion. Trauma 1 Klein calls, now. Bay 6 gets a patient who is upright and breathing and trying to sit up, which is always its own kind of warning. Sergeant Peter Dane, 28, uniform, dark with rain and grit. He has a scrape on his cheek and a polite stubbornness that military people put on like a tie. Stay down, the paramedic says, and parks the cot with a bump. He is thick-shouldered and calm, his gear arranged the way you arrange a thing you need in the dark. Hector Ruiz, CFD. Blunt chest trauma, seatbelt worn, airbags deployed. Vitals stable in transport. Complains of chest pressure, no external bleeding. No loss of consciousness, sat at 96 on room air. He walked at scene against my advice. I walked to help my buddy, Dane says through his teeth. His eyes cut to the next bay where another soldier lies quiet under a foil blanket. He was worse off. Sergeant Dane, Maya says, I am Dr. Ellis. Lie still. We will check you fast. He nods once and stops trying to sit up. He keeps his mouth closed on whatever he wants to say. Nia clips a pulse ox on his finger. Ravi steps in for a look, then gets pulled sideways by a nurse with a chest tube kit. Zoe appears long enough to hang a pressure bag. The room is a tide that reaches and retreats and leaves behind what it can. ECG, Maya says, fast ultrasound. For chest pain, Nia says, already moving. Maya sets a hand at the notch above Dane's sternum and feels the beat against her fingertips. The rhythm is fine, the amplitude is small. She watches the jugular veins under the skin of his neck. They are not shouting. They are not silent either. She listens to the sound the heart makes through the stethoscope and hears distance. How is your breathing, she asks. Short, he says, like I'm wearing a vest under my ribs. Any dizziness. Light when I got out of the truck. Fine now. The ECG prints with a comforting sawtooth. Not perfect. Not terrifying. The ultrasound machine lands by the bed with a soft thunk. Nia slaps gel on the probe. Maya sets the probe under the sternum and tips it. The screen fills with gray inside gray. The pericardial space shows a crescent that is darker than it should be. The heart looks smaller than it should look inside that crescent. It pushes against a wall that is not supposed to be there. Maya says, prepare a pericardial kit, full sterile, watch the pressure. Nia glances toward Trauma 1 where Klein is already scrubbed with a hand inside a belly that needs hands. He cannot be in 2 places. Senior backup is tied up in 3. Evelyn Tran is across the way hanging blood. The room does not have more hands than it has. It has these. You need authorization, Nia says. She says it quiet and close, not a challenge, a reminder that exists to be considered and sometimes ignored. If I wait, he will crash, Maya says. Help me set the field. Hector Ruiz has not moved from the foot of the gurney. He keeps his hands on the rails the way a man keeps hands on something not to steady it, but to steady himself. He watches the probe. He watches the way Maya holds it. He watches the thin metal at her throat when she leans and the collar shifts. He sees numbers, not many, enough. He blinks once as if rinsing his eyes. Doc, he says, and the word comes out softer than his voice normally allows. Where did you pick that up? Set the field, Maya says, eyes on the screen. I want subsyphoid approach, 2% lidocaine, 10 milliliter syringe, spinal needle. Hector swallows. He leans in 2 inches. Those numbers look like coordinates. Maya does not look up. She paints the skin below the sternum with betadine. The smell bites. She numbs the skin and walks the lidocaine into the tissue. Hector speaks again, this time to the air above the bed, this time in a tone that is mostly memory. Coast. Summer 19. You ran a line in a tent while mortar shook the poles. Captain Ellis. The room around them is drowning in other sounds. They are alone inside the small circle of this field. Nia looks at Hector because he has said a name she has not heard. Maya does not answer. Her hands are moving with a focus that makes answers irrelevant. The needle enters at a shallow angle under the xiphoid. Maya watches the screen with the kind of attention that erases everything else. The tip appears as a bright point. It walks toward the dark crescent. A tiny flash of movement and the point sits inside the space where fluid should not be. Aspirate, she says. Nia pulls back the plunger. Blood the color of cherry cola slides into the barrel. Slow, viscous. Wrong place, wrong time. Maya relaxes her wrist a hair and holds the angle. Keep going, Maya says. Nia draws until the syringe is almost full. Maya disconnects and connects another without moving the needle tip. The second syringe fills a little easier. The monitor hears the change before the people do. The heart rate that had pressed at 130 slides down. The blood pressure that had slumped at 90 lifts to 110. The oximeter number climbs by 2. Dane lets out a breath he did not know he had been holding. His shoulders ease against the mattress. His eyes go wet without permission and then dry themselves. What is that, he says. Fluid around your heart, Maya says. It was squeezing. It is less now. Hector lets the rails go. He looks like he has just seen a person pull a man from under a car with one hand. Catheter, Maya says. Nia threads a soft catheter over the needle and into the pericardial space. Maya withdraws the needle and secures the catheter with a clean loop of tape and a silk tie. The drainage bag receives what the syringes cannot hold. The ultrasound shows the dark crescent shrink to almost nothing. The heart fills and empties with a shape that makes sense again. Maya wipes the gel from the probe. She steps back to let the room breathe. Klein arrives, then gown-streaked gloves red to the wrists. He takes in the scene in one look. Dane stable, catheter draining, ultrasound on freeze with an image that would look good in a lecture slide. Office, he says to Maya, when this patient is stable. He is stable, Maya says. Continue to monitor drain output. EKG repeat in 1 hour. Admit to step down for observation. Klein's jaw tightens. He's not angry that the patient is alive. He is angry that he was not in the room to make it permitted. He points a clean elbow toward his office door, then turns on the heel of his shoe and vanishes toward Trauma 2. Hector finally speaks to Maya, not to the air. That was you, he says, finding her eyes now that there is a space for it. Captain Ellis, I was with Engine 12 when we worked with a forward team out there. You had a headlamp and hands that did not shake. Maya removes the gloves. The latex peels away and leaves her fingers cooler in the air. She drops them in the red bin. The thin metal at her throat catches light again. She adjusts the collar and it disappears. You have the wrong person, she says. Not unkind, not convincing. Hector has a radio in his hand. It chirps and he answers and says words about inbound transport and staging. He says another set of words that do not belong to this radio. He mentions a name into a network that is not hospital. He adds a unit number that lives far from the street. He does not look at Maya while he says them. Nia finishes the dressing and writes the drain volume. She does not ask what she wants to ask. She swallows it and it goes down rough. Ravi appears flushed with the heat of other rooms. We need hands in 3. Pelvic binder and blood. Go, Maya says. I am with sick. He goes. Zoe slides a second blanket under Dane's feet. She gives Maya a look that is half question and half affirmation, and then leaves to catch a new gurney with a medic still on it. The ER keeps changing shape. More people arrive. The air is louder. The sirens outside turn into brakes and shouts and running. Klein's office door is open like a mouth. Maya does not walk toward it yet. She stands at the foot of Dane's bed and watches the numbers settle. A hush falls that does not belong to the room. It belongs to a type of arrival that alters the air. Heads turn of their own accord. The automatic doors part. Rain beads on a uniform that has been tailored to fit a tall body that knows command the way a hand knows a tool. 3 silver stars throw back the harsh light. General Samuel Pierce steps into the ER. ER with 2 aides in black suits and a face that wastes nothing. His eyes move once across the room and land on Maya. He speaks without raising his voice. Captain Ellis, I need the best trauma surgeon here. Right now. For a breath, the ER goes quiet. General Samuel Pierce stands in a circle of wet floor and fluorescent light, the room bright on his stars. His eyes are steady on Maya. Yes, General Maya says. Her voice carries without volume. Heads turn. The thin piece of metal at her throat catches the light when she lifts her chin. Numbers show for a heartbeat. Then fabric hides them. Klein arrives from trauma, 1 gown, streaked mask under his chin. He takes in Pierce, then Maya, then the room that has paused without being told to. We have a critical with multi-system injuries, he says. Ellis, if you are stepping up, you have full run of this. You ask, we move. Pierce answers for him. Lieutenant Ava Romero, active duty. She was crossing under the tracks when the carriage dropped. Earlier this week, she took shrapnel in a training mishap. Imaging shows fragments near the left coronary artery. Vitals, Maya says. Blood pressure 70/40. Dr. Evelyn Tran calls from the doorway. Heart rate 130. Oh, negative. We have 2 units ready. She will not tolerate delay. Or 3, Maya says. 7 minutes. Nia, you are with me. Dr. Morales, second. Dr. Tran anesthesia. Call perfusion on standby. We are doing damage control of abdomen and chest. The room breaks and reforms around the command. Someone pages the OR. Someone clears a corridor. The elevator doors open of their own accord because the hospital knows these steps. Rain drums against the glass roof above the transport bridge. Ava Romero is small on the bed in a way that has nothing to do with size. Blood has dried on her neck in a lattice of red. The foil blanket makes a soft crackle that sounds like distant brush fire. Her eyes are closed. Her lips move once like a person answering a question while dreaming. Move, Klein says, and the team moves. The scrub sink is chrome and old. Water runs hot and fast. Maya scrubs with the mechanical grace of someone who has done it in tents and in rooms with no windows. Fingertips to elbows, palm to palm, nails to brush. She rinses and holds her hands higher than her elbows. The metal tag at her throat taps her collarbone once and goes still. Inside or. 3, the air is cooler. The light is colder. Instruments sit in ranks shining. Naya's hands fix the drapes as if laying a precise map. The metronome of Ava's heart rate rolls along too fast. The oxygen saturation number lies on the edge of a cliff and pretends it is a flat road. Knife, Maya says. Tran calls out the new pressure. 60/30. She is dry. Start the next unit, Morales says, already holding a clamp without being asked. Midline incision. Skin parts and bleeds. The peritoneum opens under gentle lift. Warmth hits the air. Blood flows up as if the body is trying to return it to the sky. Suction pulls it back into a plastic container where it belongs. Gauze packs disappear into the 4 quadrants. 2 at the liver, 2 at the spleen, 2 in the pelvis. The world becomes a red logic that requires swift fidelity to simple steps. Find the source, Maya says, and her hands do what her voice says. The splenic capsule is torn in 3 places. The tissue looks like wet paper that has been pulled too far. A gentle press gives way to more bleeding. Clamp the splenic artery, she says. Morales finds it with a calm, careful motion and takes it. The field slows. Not enough. We are taking the spleen. Morales nods once. They work together like people who already learned each other's cadence. The hilum gives up what it can. Vessels are tied and divided. The spleen comes free and lands in a basin with the soft thud of a thing that used to be part of a person. The suction picks up speed at the liver. Maya packs it again and feels the firm give. When a pack meets bleeding, it can hold back. Check the pelvis, she says. No active bleed, Morales answers, just ooze. Good. We will pack and revisit. Now the chest. Tran speaks without looking up from the head of the table. Pressure at 50. We are on vasopressor support. Heart rate 120. She's on 100% oxygen. We proceed, Maya says, sternal saw. The saw sings in a tight register that makes every hair on an arm want to stand up. Nea's face is quiet and set. The sternum opens with a smell like hot bone and metal. Retractors go in and pull back with even force. The heart sits in his house, moving faster than the rest of the room wants it to. Blood films the pericardium. A small glitter marks the epicardial surface. Fragments, Maya says. 2 superficial on the right ventricle, 1 near the left anterior descending. That one is the problem. Evelyn Tran reads the line of numbers. Pressure 40. I am hanging more. She's thin on options. We make more options, Maya says. She picks up fine forceps and a suction tip. Superficials first. She removes the visible pieces with patience that is not slow. The metal comes away and the epicardium sighs a little red. Gauze catches it before it can run. The 3rd fragment is dark and mean and sitting against the artery that feeds the front wall of the heart. She leans in till the loops hold nothing else in focus. Hold suction exactly where I place it, she says to Morales. He holds. Nia hands a 6 arrow with the point set, and sure. Maya lifts the fragment a millimeter. It shifts more than that. The artery tears. Blood floods the field and turns everything the color of urgency. The monitors go angry. Tran's voice sharpens. Pressure crashing. We are at 30. Rhythm is fast and thin. Pack above and below, Maya says. Do not press the tear. Morales packs without blocking the view. Nia has the suture ready before the words are done. Maya sets the first stitch with a movement that is all wrist and no waist. The needle bites cleanly into the edge of the arterial wall. She ties and sets and places the second. Time stretches, then snaps back into a tight line. 38 seconds. The leak slows to a well-mannered seep. She places a 3rd stitch for insurance and wets the line. No more bleeding. The artery holds. Tran calls the numbers. 45, 50, 60. 60. Heart rate down to 110. She breathes loud, then covers it with a cough. Maya looks up 1 inch. Her eyes meet Nia's for half a beat. Nia nods once, small and fierce. They irrigate with warm saline until the fluid runs clear. Maya inspects the field as if she will be quizzed on every square millimeter. Nothing else calls for the needle. She places a small patch over the repaired artery. She removes a last sliver of metal hiding near the pericardium and shows it to no one before it clinks into a basin. Return to the abdomen, Maya says. The packs come out in reverse order. The liver is less angry. The pelvis is quiet. A new pack holds what oozes. She places a temporary closure over the abdomen because the body needs a chance to catch up. She leaves a note in her head for herself and for the team that will bring this patient back when it is safe. She closes the chest with the wires that seat with soft crunches and a sternum that meets itself properly. The skin comes together neatly. Staples click like a small train. 3 hours and a little over a quarter pass between the first cut and the last stitch. The metronome on the monitor learns a slower rhythm and then keeps it. The room smells like betadine and saline and sweat that dried under gowns. The light has softened for no reason anyone can see. The rain at the windows is a mist now, not a storm. Maya steps away from the table. She peels her gloves off. They leave her fingers cool. She tugs the mask down. A trace of powder from the glove smudges her wrist. The metal tag at her throat lies flat again, numbers hidden. In the gallery above, bodies that had arranged themselves in a quiet row move as if remembering they have bones. Some clap once, then stop, because this is not a theater. Some stand with their palms flat to the glass as if trying to touch the room with fingertips. General Pierce does not clap. He folds his hands behind his back until the skin over his knuckles shines. Then he drops them and wipes his face without ceremony. Klein watches from the back of the OR, arms crossed but relaxed in a way that is new. He lets the silence last 2 beats longer than usual. Transfer to ICU, he says at last. Post-op labs, serial hemoglobin. Echo in the morning. He looks at Maya. Write your op note. I will countersign. She nods. She's not trembling. She is tired in a way that does not make her slow. She thanks the team by looking each one in the eye and letting the next breath carry all the words they do not have time to say. In the hall, the surgical caps go into a bin. Nia hands Maya a bottle of water and watches her drink. Your hands, Nia says, not meaning the hands. They did their job, Maya says. You did that under fire, Nia says. It is not a question. Maya does not answer. The elevator doors open and the transport team takes Ava up on a bed that looks too large. The doors close and the ding is too bright for the hour. Outside, OR3, the observation corridor is crowded. Chrome and glass throw back tired faces. Ravi presses against a wall as if it can hold him up. Zoe holds a paper cup with both hands and does not drink. Klein walks to Maya with a folder under his arm that should be in an office. His hair is damp along the line where the cap flattened it. He has a look she has not seen on him before, something like respect with the corners sanded smooth. Dr. Ellis, he says. He does not use fellow. He holds out the folder. Senior trauma attending. Full privileges. Build a tactical trauma curriculum. You set the protocols. You name the team. The board is ready to move. Maya looks at the folder. She does not take it yet. The thin piece of metal at her throat warms under the strip lights. She lifts a hand and touches nothing. General Pierce steps closer. He does not speak for a moment. He studies her face like a man looking at a map he has not used in years. You saved my lieutenant, he says. You have my gratitude. And something else. There are people who need what you know. Maya nods once. The nod is small and complete. They stand in a triangle that includes the past and the present and the place this hospital will occupy when the doors open again. The ER hums below them with new arrivals and older griefs. The rain has stopped arguing with the windows. Maya's pocket vibrates. She takes the phone out and wipes a wet fingerprint from the screen with the heel of her hand. An unfamiliar number from Virginia fills the display. The words beneath the number are short and formal. She looks at the screen. She does not answer. The conference room smells like stale coffee and bleach. Morning light comes in thin through the blinds. Every chair is full. Scrubs, white coats, tired faces turned forward. The ER hums below like a distant engine. Klein stands at the head of the table with a folder in his hand and a voice that has lost its edge. 6 weeks ago, I underestimated Dr. Ellis. He meets a few eyes. He lets that sit. Last night was a clinic. Damage control done fast and right. Lieutenant Romero is in the ICU with a heart that beats clean and a belly that can wait. We watched someone teach us the room. He turns to Maya. He extends the folder. Senior trauma attending, full privileges, build the program. Maya does not sit. She keeps her hands on the back of a chair. I accept with conditions. Heads tilt. First, we recruit veterans into the program and give credit for what their hands already know. Second, we partner with the VA and make sure the protocols move both ways. Third, no more blanks in my file. People here know where I learned. Klein nods once. Agreed. The word lands like a stamp. Dr. Morales speaks from halfway down the table. I want to scrub when you teach. I have things to unlearn. A low ripple of laughter. Not unkind. Nia stands in the doorway with a chart hugged to her chest and a face that says she already knew this was coming. Ravi and Zoe share a look that is half relief and half work. The meeting dissolves into lists and calls and shifts. The folder is heavy in Maya's hand in a way that does not weigh her down. In the hall, the phone in her pocket rings again. The same Virginia number. She steps into an empty consult room and answers. This is Colonel Patricia Vance, the voice says. Department of Defense Medical Command. General Pierce briefed us. Your unit's survivals from coast defied predictions. We want you to design the combat trauma curriculum. You would have access to data and support. We would coordinate with your hospital program. I keep my position here, Maya says. This is the ground where we test. Understood. Collaborative, not exclusive. I will do it, Maya says. The words feel like a piece snapping into the right cut. Thank you, doctor. The line clicks. The room is quiet again. Nia opens the door without knocking and leans on the frame. Someone is here for you. Says he is family. Maya does not move for a second. Who? Colonel Daniel Ellis, Nia says. He is in 4. The consult room smells like paper and cold air. The wall holds certificates in frames that do not lie. Colonel Ellis stands with his hands behind his back, boots damp at the edges. His hair is iron gray at the temples. His eyes are a familiar amber set harder by time. He turns. The lines around his mouth change. He takes a step, then stops. Maya. Sir, it comes out habit before anything else. He looks at the folder in her hand. He looks at the small piece of metal at her throat. He looks at the chair between them and does not sit. General Pierce called me, he says. He told me what you did. He sent records I did not deserve to read. He clears his throat. It does not help. I thought I knew what service meant. I was wrong. Maya's fingers find the edge of the table. Her nails press the laminate. She does not try to make it easier. She lets him work. He tries again. I told you there was one way to carry the name. You carried it in a place I could not see. I'm sorry. He says the last 2 words like a man lifting something heavy off the floor. She crosses the space. The hug is careful then not careful. He smells like rain and starch. His hand goes to the back of her head for a second and then falls away. They sit. They talk in pieces. He asks about headlamps and tents. She asks about winter runs and morning PT and the sound of his boots on a concrete floor. His voice is quiet when he leaves. You did not leave the line, he says. You moved it. The simulation lab opens with a hiss from a pneumatic door a few weeks later. The mannequins look like people until you touch them. 17 veterans sit forward in their chairs. 6 civilian surgeons hold pens and drop them when the first scenario starts. The room fills with the sound of a monitor counting time. Beep, beep, beep. Gauze packs go in. Tourniquets rotate to the right pressure. A resident bags air while reciting the sequence. Maya moves through the clatter. She taps a wrist here. She changes a grip there. She makes a small adjustment to a clamp and a big change to a bleeding rate. Nia calls out times. Morales holds the back table and nods when someone gets it right. Survival numbers at Lakeshore Mercy climb over the next months. The graphs look better not because they are pretty, but because families go home with someone they did not think they would see again. The VA sends a team to watch. The DOD sends data that make the rounds of the office printers. Maya writes late. She prints less. She teaches with a whiteboard marker and an old sawbone and a tray of tools that live best in a hand. Ava Romero walks into Maya's office on a Thursday afternoon with a cardigan over hospital tee and a line of staples fading to pink. She stands straighter than a week ago. She holds herself like a person who has learned her center again. I wanted to say thank you, Ava says. Her voice is clear. My boy is 4. He sleeps with a toy fire truck. He asked if my heart makes noise. I told him yes. I told him I could hear it now. Maya smiles with her eyes. Take your time with stairs, she says. Breathe deeper every day. Come back if you feel tightness you do not trust. Ava nods. She looks at the thin piece of metal at Maya's throat and then back at Maya's face. She does not ask. She leaves with a step that is not careful anymore. The ER calls with the sound of a pager that snakes through walls and skin. Multi-vehicle pile up on the Kennedy. 3 criticals. 2 minutes. Maya rises. The folder sits open on the desk. The metal at her throat lies flat. She takes a pair of gloves from the box on the wall. 1 motion per glove. The latex snaps against her wrists. Second skin. The lights on the critical bays warm to red. The train outside hits the rail joint and sings. She pushes through the double doors. The room unwraps itself for work. Monitors pick up the beat. Hands find tools. Voices set the tempo. The metronome starts and the day receives it. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.